Menopause comes with its fair share of challenges. But did you know these hormonal changes can also cause body aches and pains? Here are 10 common pain areas in menopause. Muscle and joint pain. Ever feel like your body is just falling apart during perimenopause or menopause? Achy joints, stiff muscles. You're not alone. Many women experience this, but don't always realize it's linked to menopause. Here's what's happening. When estrogen starts to decline, it takes a toll on your muscles, bones, and even the stem cells that help repair them. That's because these tissues all have estrogen receptors, and estrogen plays a big role in keeping inflammation in check. So as your body produces less of it, inflammation increases, leading to sore knees, stiff shoulders, and aching hands. The good news is, there are ways to fight back. Swapping sugary carbs for fiber-rich ones, think broccoli instead of bread, can help lower inflammation and ease discomfort. Number 2 is pain no one talks about. Female-focused pain. Let's get real. Menopause can bring some seriously uncomfortable changes, especially down there. It's not just you, and it's definitely not in your head. Many women experience vaginal atrophy, and it can feel miserable. When estrogen levels drop, the delicate tissues in your intimate area become thinner, drier, and far more sensitive. This can lead to burning, itching, soreness, frequent urinary tract infections, constant urges to pee, pain during intimacy, and even unexpected spotting. Moisturizers can help, but not all work for everyone. Some women react to the ingredients, while others barely notice a difference. If this sounds familiar, a tiny dose of estrogen cream applied directly to the area can be a safe and effective solution for many. Noticing that your breasts feel different during menopause? Softer, less full, maybe even a little deflated? Don't worry, that is a completely natural change. Breast pain. Before menopause, your breasts are made of a mix of glandular and fatty tissue. But when estrogen declines, that glandular tissue shrinks and is gradually replaced with more fat. This makes breasts less dense, softer, and often less full than they used to be, leading to sore, aching breasts. Some women even experience a stabbing, burning sensation. Speaking of a burning sensation, our next pain area is legs. Menopause or perimenopause bring all sorts of surprises. And unfortunately, aching, twitching, cramping legs can be one of them. The drop in estrogen affects magnesium absorption, fluid balance, circulation, and even stress levels. And to make things worse, these symptoms tend to flare up when you're trying to relax or sleep, turning restful nights into restless ones. The result? Fatigue, anxiety, and even more discomfort. It's a cycle that can feel impossible to break. However, staying hydrated, adding magnesium-rich foods like leafy greens and nuts, or supplements to your diet, and gentle stretching can all make a big difference. This next pain is very common during menopause, and it can bring all sorts of symptoms. These include cramping, aching, bloating, soreness, or even sharp stabbing sensations. I'm talking about abdominal pain. What's the cause? The truth is, it can be a mix of things. Changes in digestion like constipation, diarrhea, or IBS, PMS-like symptoms, pelvic floor issues, fibroids, cysts, or endometriosis can all play a role. And because these symptoms overlap, pinpointing the exact cause isn't always straightforward. That's why it's important to listen to your body. If the pain is persistent, severe, or it just doesn't feel right, don't ignore it. Check in with a doctor to uncover the root cause and get you the relief you deserve. Moving on, we have Headaches. If you're suddenly dealing with more headaches or migraines during menopause, you're not imagining it. These painful episodes are common when hormone levels fluctuate wildly. Estrogen levels drop right before menstruation, triggering headaches in many women. Add in the extra stress and anxiety that often come with menopause, and it's the perfect storm for pounding, throbbing headaches, or even full-blown migraines. And migraines, they are no joke. They can bring nausea, sensitivity to light, pulsing pain, and even vomiting, making it impossible to function. So make sure you stay hydrated, get enough sleep, manage stress, and watch for food triggers like caffeine or processed foods. Tendon pain. Yup, you heard that right. If you've suddenly been diagnosed with golfer's elbow, tennis elbow, wrist pain, or Achilles tendonitis, menopause might be the culprit. When estrogen levels decrease, it slows down collagen production, the very thing that keeps your tendons strong and flexible. With less collagen, your tendons become weaker, more prone to tiny injuries, and take much longer to heal. It's no wonder so many women feel older and achier than they actually are during menopause. Next is a common menopausal complaint that sends many women to the ER, fearing that it may be something heart-related. Chest pains. While it's always important to rule out serious heart issues, menopause itself can cause chest pains. A reduction in estrogen can lead to anxiety, stress, panic attacks, heart palpitations, and even costochondritis, inflammation in the chest wall. On top of that, digestive issues like acid reflux and bloating can cause discomfort that feels alarmingly similar to heart pain. Now, knowing this doesn't make it any less frightening, but if you experience chest pain, always get it checked. Better safe than sorry. If heart issues are ruled out, managing stress, practicing deep breathing, and adopting an anti-inflammatory diet can all help ease this discomfort. Moving on, we have neck and shoulder pain. As estrogen levels drop, your joints, tissues, and muscles lose some of their natural flexibility. This, combined with increased inflammation and stress, can lead to tight, painful shoulders and a stiff, aching neck. For some women, it even develops into a frozen shoulder, a condition that severely limits movement and can take months of physical therapy to heal. The good news is that gentle stretching, strength training, massage, and stress management techniques can all help ease the pain and restore mobility. Okay, last but not least is stomach pain. If you have been feeling bloated, gassy, or dealing with acid reflux more than ever, blame it on falling estrogen and rising cortisol. These hormonal shifts can slow digestion, making stomach issues like indigestion, acid reflux, and bloating way more common. It is frustrating, but you're not powerless. Simple tweaks can help, like eating smaller, more frequent meals to avoid overwhelming your digestive system. Cut back on processed foods and sugar, which can trigger inflammation and discomfort. Also, make sure you stay hydrated, of course, and add fiber-rich foods. Think leafy greens, berries, and whole grains to keep things moving smoothly. Menopause may bring challenges, but understanding your body is the first step to feeling better. Listen to what it needs, make small changes, and take back control. Have you noticed any unexpected aches and pains? Share your experience in the comments, and subscribe for more tips on navigating menopause.